going to say it again. Denise Nichols here with Motivate Therapy. Here live to talk about my favorite thing, exercises or self-care solutions for post-COVID syndrome, but really anything that is affecting your core health. And so I'm talking about upper core exercises. And so we're going to really talk about what upper core even means, because you probably don't even know necessarily if you have an upper core exercise, a need to exercise your upper core. So again, I'm Denise Nichols, owner of Motivate Therapy, author of Your Self-Care Matrix. I'm an occupational therapist and a pelvic floor specialist. So, which means that I am an expert in the muscles of the pelvic floor and have a unique understanding of core muscles and how they interact and affect your daily function. So we're going to start with saying cheers. So I'll give you a second to get a glass of water if you don't have one, so you can cheers with me, because this is our exercise number one for your upper core health. Grab your glass and let's say cheers to upper core health. Exercise number one, drink your water. We're going to sip, not chug, throughout the day. So in my book, Your Self-Care Matrix, I talk about really understanding the 11 biological systems in your body. And so your upper core, right? We talk about, I have been talking about your floor. Where is your floor? Oh, it's missing. There it is, it fell out. Pelvis, your floor, right? So we say if you have a floor, then you have a ceiling, right? You might not know about me that I'm from out east. So if you have a floor, you have a roof, a roof. How do you say it? I know it's telling of where you are in the world. I say roof. You tell me whether you're watching this live or replay. Do you say R-O-O-F or R-U-F? I say, what do I say? I say roof. You have a roof. Your roof, your upper core, is your throat and glottal muscles. So when you're drinking water, you are using your throat and glottal muscles. So your upper core, right, when you're using your throat and glottal muscles, you're using your musculoskeletal system, right? So that's 2 of the 11 systems, your jaw and masseter muscles, your throat and glottal muscles. So your head and neck connect to your chest and shoulder, and then your ribs, and then that connects to your diaphragm. Your diaphragm then sits on top of and connects to your organs. Really, the majority of your organs are housed right through this area, and your diaphragm really sits on, and it's really neat if you were to look at a cadaver diaphragm. There's notches that are set to connect to your liver and all your organs. So the swallowing muscle, then your trachea and your mouth to your anus is one really track. It's quite amazing. And then so that water just went from your mouth all the way through down, and then eventually will go through to the stomach and then through the rest of your body, and then eventually will go down through your bladder and then out your urethra, and then what your body needs will go to the organs it needs to go through. 75% of your body is water. 65% of your brain is water. It needs water. So your body has basic economics. It knows what it needs for water, and then what's left over, your bowels need. So it needs water, super important. So you're using your musculoskeletal system to swallow the water. Your digestive system needs the water to be healthy as well. So we start with the upper core, the musculoskeletal system, and then our nervous system, our brain is housed up here as well. So, but let's go back to the digestive system. So when we swallow, water goes through the epigastric, the stomach. We already talked about that the water is really important to be able to suck up and form the stool in order to have an easy movement. For those of you who don't have easy movements, you know that constipation is no fun. And stress. When we talked about post-COVID and having any kind of a syndrome or any kind of a non-healthy system, what you might not know about digestion and the nervous system is that 95% of your serotonin, your happy drug, your happy hormone is 95% of it is made in your gut. And so if the gut's not happy, I say ain't nobody happy. It's really important that serotonin, that the gut is happy. It affects your mood, your memory, your concentration. And we talked before that post-COVID really does affect your memory and your thinking. And I've been talking to people that really are finding that. They're calling it COVID brain. So drinking and being really good to your digestive system is important. But not to mention just drinking water, doing good things for your upper core. Water is part of core health. I know it seems like a simple, easy thing, but upper core exercise number 1, drink your water. Remember too about post-COVID is loss of smell, February 27th, it knows me a day, right? That's not a word any of us thought we would ever know. But loss of smell and loss of taste go hand in hand. You lose the joy of smell and taste. You lose the joy of eating, and then that affects your digestive system as well. So drink your water, people. And sipping, sip, not chug throughout the day. Medical providers, we end up getting stuck in rooms all day. And so we do end up chugging and not sipping throughout the day. So sip with me during lunch. Another easy upper core exercise that we don't think of the importance of, dental floss. Teeth health, really important. When we're not, when we're allowing that debris to stay in there, that's also affecting the health of the mouth and the jaw and the upper core health as well. And like I said, the upper core, we're talking about a pressure system through here. So we want this upper area to be healthy. That affects the tension of the jaw, and bacteria up here affects bacteria below. The cells in the mouth and the throat and the nose run continuously down the throat into the stomach. So keeping the mouth, the teeth, the gums healthy is an easy daily practice. Awesome. Okay, so that's 2, drinking water and daily flossing. Another great thing is diaphragmatic breathing. And hopefully you're watching, you're staying on top of our exercises that we're showing you. I just recently posted 4 easy positions for diaphragmatic breathing. On your back in a 90-90 position, on your stomach over a pillow. What else was there? Laying on your side. Let's do in a reclined position. So laying back, you can do laying on your stomach as well, legs over a pillow if you would like. Really anything that's comfortable for you. But a way to really get, another way to get the upper core is through the respiratory system, obviously diaphragmatic breathing, but also the integumentary system through the skin is using an essential oil. And you can do lavender if you want calming. You can do peppermint if, since we're in the middle of the day, if you want more, more energizing. And it would just be one, you could just use one little drop, and you could put it on, you know, rub it into your hands. You could rub it on your face. And you can just breathe in, lay your hands on your lap, and let's just do an inhale through your nose, 2, 3, and then exhale through pursed lips for 5, 4, 3, 2, 1. Inhale for 3, out for 5, in for 3, out for 5, in for 3, out for 5, two more, in for 3, out for 5, last one, in for 3, out for 5, beautiful. You just notice how you feel. So we got lots of systems on that one. Integumentary, which is your skin, which is the largest system in your body and is getting bombarded all day long. And that really gets affected, right, with COVID, and can get stressed out very easily. And can very easily get calmed down too. So lotions, essential oils, touch, which I think we're all lacking in. I know I'm missing hugs during this time period. The nervous system, diaphragmatic breathing, respiratory, cardiopulmonary, right? So the heart, the lungs, the respiratory system, nervous system, integumentary system, the nervous system, musculoskeletal system, because breathing uses the skeletal system and the muscles. So all of that just got calmed down. And then the endocrine system, which is the hormones. We talked about serotonin in the gut. By breathing and calming everything down, by drinking your water, by flossing your teeth, that gets the digestive system, which also then gets the endocrine system. Anyone that's dealt with hot flashes, diaphragmatic breathing can really help with that as well. We talked about how post-COVID syndrome, anyone that is already going through something else. I know for me, I think I was starting to go through menopause when I got hit with Lyme disease. So someone who got COVID when they were in the middle of something else like menopause, those hormonal changes could affect how you heal. Same thing with type. If you had diabetes or already had some kind of respiratory issue or cardiopulmonary issue, that is why looking at all of the systems in your body and doing things that can help all of them heal. And it doesn't have to be anything, we want to look at the natural conservative approaches. So drinking water, eating fiber, doing slow diaphragmatic breathing, using essential oils, things that are common for you. Okay, so diaphragmatic breathing. One of the things about diaphragmatic breathing, especially if you have something that makes breathing uncomfortable, makes you feel like you can't move through the upper rib area, which we now are learning the upper core is the jaw, the throat, the ribs, the pecs, the shoulders, we know that a lot of us carry stress and tension in our neck and shoulders area, as well as our ribs and upper chest. So if it's uncomfortable to move and to feel like you can't move through here, then stretching and moving in a way that is comfortable is important, to do daily movements that are comfortable. So the lymphatic system is another area that we don't really, I don't think we're taught about very much, but it is really important. So muscles need blood flow to be happy and healthy. And I talked last week about the lymphatic system and how when the body is in a state of stress, which illness is stressful to the system, the body will kind of bubble wrap. So it'll inflame the area. So we can get an inflammation through this area. Breast cancer is certainly one thing I think a lot of people understand, that the lymph nodes will get inflamed. And so that area can get removed. But we can do lymphatic, we have lymph nodes everywhere, but they're most concentrated in the armpits and the groin. So doing a lymphatic massage through this area can be good to kind of stimulate this area to move lymphatic out, so we can get blood flow in that can relax the area, and then we can stretch and open and elongate the muscles, and then it can feel easier to move them, and then they can function better, like breathing and stretching and relaxing. And then it can be easier to strengthen them, which we'll talk more about this month. So lymphatic massage, super easy. And I think it's really good to do in the shower, where you can rest your hand on the shower wall. You can use soapy hands. And we say skin stretch, so we're not pushing hard, but we're not super soft. You're doing a skin stretch. So open hand, we're on the armpit, axillary area, to use therapy speak, and we're doing circles, somewhere in about the 10 to 20 area. And we're gonna go, 10 to 20 times. And if we can, think about, as we inhale, think about that container, inhaling rib cage out, exhale. So feel the rib cage go out into your hands as you inhale, and then fall back down towards your center and the chair on your exhale. And then we'll switch sides. So if it's not comfortable to hold your arm up, then you can have it rested down. So we're just stimulating this area. So great thing to do first thing in the morning. Beautiful. Okay, and then we'll relax. And then let's just put your hands on your rib cage like this, relax your shoulders, and let's just take a deep breath in. Feel the rib cage go out and then fall back in. Let's do 2 more of those. Such a great thing to do for yourself in the middle of the day, or wherever you may be doing this, wherever, whenever. 1 more. Just thank your body for doing this for you, for relearning. Just accept wherever your body is right now. Because it can, no matter your age, no matter the stage your health is. There are 11 systems, always learning how to survive and thrive and adapt. But you checking in and being aware is how it can keep readapting, because it will learn from a stressful situation. Oh, protect, protect. But it will continue to stay in that protective position, even when the disease or the reason to protect is gone, right? The stress of COVID is gone, but the protective system is still there, right? The pregnancy is gone, right? But the adaptive position, the waddle movement maybe is still there. The reason to strain to breathe might be gone, but the muscle protective system is still there. You might have to check in and do some stretching and some breathing and some relaxing and checking in that the stress isn't there. I'm not intubated. I'm not in the hospital anymore. The pain isn't there anymore. The reason for the pain isn't there anymore. Checking back in, retraining your body. That is necessary throughout our lives, and that's okay. It doesn't mean you're broken. It doesn't mean you're broken. We always need to give ourselves permission to be transformed. Every day is permission to be transformed. Okay, so if you're in a chair with a bottom, then you can grab the bottom of the chair to lock down the shoulder. This hand comes on top. You're gonna sit up tall, so you're sitting right on top of your butt bones. Inhale, just the weight of the arm. Exhale, this ear towards the shoulder. Inhale, back to center. Exhale. Inhale. We're just gonna go to a comfortable stretch, elongating. Inhale, back to center. Exhale one more time. Exhale, deepen. Inhale, we're just gonna look up. Exhale, soften. Inhale, come back to center. Exhale, we're gonna switch hands. This hand reaches towards the side of the chair. Inhale, hand on top. Exhale. So I'm just grabbing the bottom. Inhale, back to center. Exhale, I'm gonna stop. I'm not gonna crank. I'm gonna stop before I feel any tingling or pain. Inhale, back to center. Exhale, left ear to shoulder. Inhale, back to center. Exhale, left ear to shoulder. Inhale, back to center. Exhale, left ear to shoulder. I'm just gonna look up if I can comfortably. Breathe and sink. Good, inhale, back to center. Okay, coming back. Now this hand's gonna reach to the front corner of the chair. Hand back on, I'm gonna inhale. Exhale, I'm gonna look away, exhale. So I'm going opposite diagonal. Exhale, I'm gonna look up and turn away. So exhale, diagonal, like this, opposite diagonal as I exhale. So I'm gonna feel a stretch in the front area. So inhale, exhale. So you can choose to inhale, elongate, exhale, soften, or you can choose to inhale, come back, and exhale, stretch. Inhale, come back. Now be careful not to arch your back. Don't let your back be all archy here. Keep your core solid. Don't let the girls stick up. Keep them where they are. We're just moving the neck away from the shoulder. One more time. Inhale, exhale. Stay there if you want for a breath. Come back to center. Let's just curl for a second. All the way down if you want. Coming back up. Beautiful. Other side. So left hand on top, right hand front. Inhale, exhale. So inhale, coming back. So right hand is in the front corner. And we're taking the left ear towards the left back pocket. Inhale, exhale. Inhale, center, exhale. You can stay here if you want. Inhale, elongate, exhale. Inhale, exhale. Beautiful. Inhale. One more time, exhale. Inhale, coming up. Exhale, just gently coming back. Okay, let's just do one more. We're going to go to the back corner of the chair. And we're going to inhale. We're going to turn opposite diagonal and go forward now. So I'm turning away from the shoulder and going down. So I'm going to feel it behind. Inhale, exhale towards, so the nose towards the right pocket. I can inhale, lengthen. Exhale, soften. Or I can inhale, come back to center. And then exhale, come down. One breath here. Inhale, come back. Exhale, soften. Right hand finds the right back corner. Left hand turns towards the left pocket. Exhale, inhale, elongate the right upper trap. Exhale. This is usually the kind of the hurt so good. This is the area we tend to hold tension. Watch your back. I like to tend to arch here, so find your butt bones. The tailbone should be sticking down towards the center of the floor, not tucked under, but not sticking way out behind us either. Inhale, exhale. So 3 slow, deep breaths in one position, or inhaling center, exhaling down 3 times. Whatever feels good. Let's inhale, interlace the hands. Looking up, exhale, just gentle, not pulling, just rolling down, slowly rolling back. Let's take a breath here. Beautiful. All right, let's just check in. On a scale of 0 to 10, 10 being I have no energy at all, 0, I have a ton of energy. Where's your energy level right now before returning back to your day? Tapping. Tapping is awesome for the nervous system as far as grounding us. So when we have any kind of a post syndrome, whenever we have chronic pain, chronic illness, a chronic anything, any symptom, any signals that our body is constantly telling us, whether it's leakage, constipation, pain, anything that's affecting our quality of life, anything that we've had to form our life around. So energy or pain, our nervous system can get stressed, right? And so breathing is a great way to bring us back to the moment. So just bringing us back to the present is truly the only way to keep bringing our energy back, to not keep spending it. So tapping is a great way to keep putting our pennies back in our pocket. So tapping is a way to calm the nervous system, to ground you. So think about whether it's pain or energy, what is your level now? I always like to do a pre and post score of how you're feeling. So maybe you're feeling different than when you first started listening to me and doing the exercises with me. But tapping is a great way, an easy, quick way to feel grounded, to be able to improve your memory and your concentration as well as your energy. And having some kind of a confirmation and an affirmation is really good. So for now, we're just going to use an acceptance. I accept where I am right now. I accept my energy level. I accept my pain level. I accept the symptoms that I have right now. So for now, we're going to start just using our fingertips, and we're just going to tap along the top of our head. I accept whatever my number is for my energy level right now. I am grateful for this time to be able to be with myself right now in this moment. Moving here, right between the eyes. I love and accept myself. Okay, now going to the sides. Take a breath. In here. And then in here. I have the energy that I need. I accept where I am at this moment in time. I'm coming here, I'm just doing circles up and around. I'm grateful for all 11 of my biological systems. I'm grateful for the health of my body, my mind, and my spirit. I'm grateful for the opportunity to learn and to grow, coming on either side of the armpits. And I take a breath. Tapping the palm. I accept where I am this moment in time. Karate chop on the side of the thumbs and the breath. I'm grateful for the opportunity to integrate my upper core and my lower core, my head and my heart, my stomach, my pelvis, my mind and my heart and my stomach. Where thoughts go in, where food goes in, and where food goes out. Where I express love, where I feel love. I love and accept all my possibilities and all of my limitations. I'm grateful for my healing abilities, for what my body has been able to do. I'm grateful for the energy that I have today. Take a breath. Accept and love where I am right now. I am open to every new possibility. And I'm open to consistently creating new habits like the ones that I learned today. I know that my body can create new habits, new healthy habits, and that every day is an opportunity to learn and transform. And take a breath. Bring awareness back in to your energy, to how you feel wherever you are, your energy level, your pain level, your concentration, your presence, your attitude. And I hope that you can bring what you've learned, your awareness and your presence and your energy with abundance into this week, that you will continue to learn consistent, healthy habits, that you learn from awareness of the now so that you can let go of old habits that are no longer supporting you so that you can grow forward and be an empowered person, setting boundaries and having an abundant, happy, healthy week. I look forward to continuing to learn and grow with you throughout the rest of this month. Have a wonderful week. Take care.